We'll be starting in exactly 1 minute. Make yourself a coffee, a tea, and we'll be right over. Okay, hi everybody. It's very nice to meet you. My name is Shira Reiner. I'm a nurse, and today we're going to discuss one of the areas that are very, very important in the lives of special needs people and people with different illnesses, and that is getting yourself familiar with stem cell therapy. We're going to speak about 3 different kinds of stem cells. There are over 5 different methods of administering stem cells. We're only going to discuss 3 tonight. And of course, we're going to also explain the process and everything that has to do with stem cells. If at any point you feel you want to ask a question, please just open the microphone and ask. If not, you can write in the chat. And I promise to try and answer everybody's questions. So without further ado, let's start stem cell therapy starting right now. So today we're going to explain what is stem cell therapy and how it can assist children with autism and other medical conditions. What are the risks? What are the side effects? How does it work? How to get to these treatments? And this is what we're going to discuss today. We're going to learn about the different treatment options, treatment ways to access, and of course, explain about the different clinics. So before we start, if you want to write down in the chat so I can refer to your personal case, how old is the patient and what is their diagnosis? If you can write it now in the chat, that way I can, of course, see each one of the patients and be more specific towards their condition. So everybody has a dream, and this dream is universal. It doesn't matter what country you're in, how old are your family members, what's your culture. And the dream is that your child will grow and do what everybody else does. When children starts walking, my child will start walking. When children will start speaking, my child will start speaking, etc. Here in Israel, it means finish 12 years of education, go to the army, get a degree, get married, have children. This is the normal routine for Israeli children. And it differs from one country to another, but the ideal is always the same. Be normal, be regular. And as a parent, you want your children to be amazing, but you also want them to be very, very regular. And if you are here, then it must not be the case for you. Because normally when you're here, it means that something did not go quite as well for your child. And we all try what we know from home, what our parents have tried. We go to therapy, we go to hydrotherapy, speech therapy, etc. And at some point, we realize this is not quite working, and our children are not progressing quite as well as we hope. And then what we do is we try to think about something else that works. And for me and my family, what had worked was stem cells. So today we're going to lift the veil a little bit on this subject and discuss what we can do for these children who need stem cells. It's really important if you write the diagnosis so I know exactly where to refer you. So the process we're going to discuss today is the different treatment options that are possible in different medical cases. And I'll explain what child needs to go to what treatment, and we divide it accordingly of age and accordingly of treatment of the different treatments that children need. We're going to discuss a little bit about what is necessary to maximize each and every treatment. And as a lot of people see online, on YouTube, on Facebook, I'm a mom of four special needs children. My children are very different from each other, but they all have something in common. They're all autistic. And you can see here, my oldest son, he's nearly 11. My daughter, she's 9.5. My middle son, he is 8 nearly. And my youngest, who's 3.5. They're all autistic. They're all similar, but they're all completely different. Two of them will eventually have what we call a normal life. They will grow, they will acquire friends, get married, hopefully, have kids, hopefully, work, be sustainable on their own. And my oldest and my youngest are probably not going to get there. The differences has to do with what happened to them in their personal medical history. I have two children with severe epilepsy due to stem cells, not exactly an active epilepsy right now. It's not very active. But my other two children didn't have epilepsy. And so their ability to rehabilitate from autism was much, much better. I have something here that's not very pleasant. Eyes. Oh, can you see me well? Because I can't see my friends. There we go. Let's see this. Okay, yeah, that's fine. Sensory issues. They are important in every age and every diagnosis. There we go. This is better. Okay. So we have different children. With each one of our children, their path is a little different. Their treatment protocol was a little different, but also the outcome. And the outcome has to do with who they are, what's their medical history, how old we treated them. We treated our youngest at 2 years old, but we treated our middle child at 4 years old. Why is our middle child doing better than my youngest? And why we didn't treat our daughter at all? What was the reason? So different children, different treatment protocols, and we're going to start discussing it now. It's very important to remember that stem cells, as a general, are building our bodies at every second of the day. They are part of the building mechanism built into your system. Your bone marrow makes stem cells, and these cells go to where they're needed, usually to places that go through something called apoptosis. That's death of cell. It's something very normal that happens every day in your body. These cells are being regenerated. How are they being regenerated? By an order made by the stem cells. And inflammation processes. So if you had a bleed somewhere, or if you've had tonsillitis or an ear infection, your stem cells will get there and start regenerating the process to fight the infection and regenerate the organ that was hurt. This is what stem cells do. They do it every single day in every single body, in every single organ, and that is normal. So you ask yourself, so why don't they fight autism? Or why don't they fight the damage happening in CP? Or why don't they fight Parkinson's? The reason is that, as a lot of things, dosage is important. So our body makes enough to maintain our body. So normal routine care. It does not make enough cells to help these extraordinary conditions. And that is why we're able to take stem cells from a different origin and add them to our immune system to help our immune system fight these conditions. So our first source out of 3 we're going to discuss today, again, there's 5 in total. Okay, just to make it clear, 5 options to get stem cells. The first one is very simple, our skin. We do use skin grafts. Skin grafts are made from stem cells originated in the person's skin. Not always the same person. Sometimes take a cell made from somebody else and put it on the recipient. But normally, these are self-donated stem cells from the skin that make skin grafts. That's option 1. We use it in burn patients. Option 2, liposuction, our fats. Our fat tissues, especially the one in our belly, contains a lot of stem cells. That is normal. This is part of the mechanism. We can extract them during a liposuction, separate them in a lab, and manufacture self-donated stem cells. We do that with adults. We can treat orthopedic problems like problems with knees and tennis elbow, etc. But it's not being used with children. The reason is that there's just not enough fat tissue in their stomachs. So for children, not an option. The next origin is what we're going to talk about now. That's cord blood based donation or cord blood based treatment. Basically, cord blood is what we extract from the umbilical cord during labor. So a woman would have given birth, we cut the umbilical cord and we drain the rest of the blood from the cord, exactly like we would if we would do blood donation. So it's the same kind of bag, same kind of needle, except of a vein in your arm. We pierce the vein in the baby's umbilical cord once the baby is already separated from the mother. That blood contains a lot of stem cells, but these stem cells are very unique. These stem cells produced by the embryo, so this is the embryo's blood, contained a lot of very ancient stem cells that can develop into any cell in our body. This unit can be used to manufacture bone marrow. So if I'll give it to a cancer patient, it can manufacture new bone marrow. It can use for CP patients, so patients with cerebral palsy or after brain injury benefit a lot from this kind of treatment. It can be used for toddlers and younger children. So every child under the age of 3 and under 12 kilograms will receive cord blood-based treatment. It can also be used for older children with epilepsy or autism. But when I make the choice between the two, younger patients will get this treatment. Older autism patients have more options. Cord blood is expensive. It's important to say because we don't manipulate cord blood. We cannot multiply it. Not today. We will in the very near future, hopefully within 5 years. We cannot change the component of the cord blood, so we can't take out things, can't add to it things. So whatever we extract from that woman who's given birth, that's what we have. It's important to say that different countries have different protocols. We specifically work with a company called CBC Health. They're located in Europe. They have various bank locations, but they have one treatment clinic for children, and that is in Netherlands in a place called Eindhoven. Okay, so if you need cord blood, again, CP patients, patients who had brain bleeds, younger autistic children who's not turned 3 or not turned 12 kilo, those children will get cord blood as a default. Other patients may get cord blood, but they may also refer to a different treatment that's a bit cheaper. Again, cord blood is expensive because of the very difficult way to process it, the fact that we can't manipulate it. 1 unit equals 1 treatment, and there is a weight to amount of cell limit. So CBC Health will give 50 million cells per kilo. So again, sizes of units, weight of child, these things all have a meaning. So our first treatment, again, cord blood-based treatment. We are going to move on to our second kind of treatment. So this one is a bit more difficult to understand, so bear with me, if you may. Umbilical cord tissue cells. So if you remember, your baby was born and it had the baby, the umbilical cord, and the placenta. And if you had a very nice midwife, your midwife would have said, listen, would you like to see where your baby was housed for the last 9 months? And if you are up to it, you would say yes. And then she would show you this half a circle or a full circle, and you'd had red stuff on the one side and white, glossy, sort of rubbery material on the inside. So the inside, the part that belongs to the baby, also called Wharton jelly, is this white, tough, rubbery substance, and it is a fat substance. Okay, so again, stromal cells. This is a stroma. Stroma equals fat. And within there are the same ancient kind of cells that are called mesenchymal stromal cells. These cells are also made from our bone marrow, but for a baby, they're made very early on in the baby's development. In fact, in day number 4, our babies make our placenta and umbilical cord. So, unlike our bone marrow and unlike our blood, they're missing a mechanism called HLA. HLA is the protein that causes our body to identify our organs as their own. That means that the placenta is a non-organ. At the end of the pregnancy, it will detach from the mother and pass away. The reason for it is because the placenta cannot regenerate itself unless it's attached to a hostess. And that is because they don't have HLA. However, the stem cells in the placenta, if they'll be taken out from the placenta close to birth, can be duplicated. And from each placenta and umbilical cord, we can create up to 10 units of therapy for people. So that is why, if you will see in the prices, the placenta and umbilical cord tissue and cells are significantly cheaper than cord blood. We can manipulate this material, multiply it in the lab up to a certain amount of cells. And from one healthy baby and one healthy mother, we can make many, many units of treatment. Okay, very important. So these cells will be fine to any child who is not a CP child. Okay, no CP because we know for some reason the CP children respond to a different kind of cell called hematopoietic stem cell. But brain damage, children who are over the age of three or close to the age of 3, more than 12 kilo can definitely use this method of treatment. You can administer MSC cells via IV, intrathecal, which I don't recommend to do. We'll talk about it in a little bit. Into a muscle and inhalation. It's very easy to do. The company that we prefer working with called Swiss Medica, this is where our children are being treated. It's in Belgrade, Serbia. It's a very, very well-established company, and it's turning into a children's hospital, an adult hospital for stem cells very, very soon, I think in October. So it's becoming very, very big. For their protocol, they have 3 different protocols. They have toddlers protocol, which is very short. They have the medium children's protocol, which is 5 days long, and they have teenagers and adults protocols, which are different. So here it makes a difference what protocol you go to. Different protocols for different people. If this is something that you're interested in, you're more than welcome to contact me and we'll go into the fine details. Cord blood, I'm sorry, I didn't say the other part for cord blood, you give it IV or intrathecal. I don't recommend to give materials to children who do not communicate through the spine, and we'll talk about it on our next source. Okay, so third source for stem cells is bone marrow. Staying like if you think, God forbid, about cancer patients or bone marrow patients, we extract bone marrow from big bones, so that will be the hip bone or the femur bone, okay, so your thigh bone. The way to extract them is to take a very big needle and just go into the bone and pull it out. Now, we won't do it just in one location. We'll do 3 or 4 pokes like that. We extract the bone marrow, put it in a centrifuge, and basically separate the white cells from the rest of the blood cells, and then just inject it back. The injection in this method is done through the spine. Here's my problem. We do this protocol every single day in anywhere in the world. I have 2 problems with this method. One, if it's not a cancer patient, there are better options. So I don't like doing medical procedures that are not necessary. The other is, we're talking largely about children who cannot report back to us. 3.5 years ago, I had my last child. I had a normal delivery and I took an epidural. Okay, so I was anesthetized through my spine. Very similar to the way we inject stem cells through the spine. What happened in the next 5 days was like this. I had the spinal tap taken out and a little bit of cerebral spinal fluid, the fluid that's causing our brain to work and keep the balance within our spine, had leaked outside. It was very small, so I couldn't see it and I couldn't feel it, but I could feel the massive headache that I had that couldn't allow me to lift my head over the bed. And I was very, very ill. I was so ill that when I was discharged home, I was dizzy, I was sick, I was not feeling well. But even me, a trained nurse, an orthopedic nurse, a delivery nurse who's been working in ORs on surgical cases, on delivering women, could not say that I have a cerebral spinal leak due to epidural. It took me 5 days to understand. By that time, I was flat on the back of a taxi going back to the hospital, rushed into an emergency procedure where they plugged it. So, when I'm being asked about bone marrow application or any treatment done through the spine for children who are not verbal, not doing well with reporting, have problems with sensation in their backs, my answer will always be, if it's not absolutely necessary, please don't. Because even I, a trained nurse who understands and knows how to identify this kind of problem, couldn't identify it when it was on my body. And honestly, even people around me were under the impression I'm doing okay, that I'm recovering. So for bone marrow, yes, this is totally possible. Yes, it's safe to do. However, the side effect of CSF leakage is very, very problematic because we don't have a good information output from our children. So when people ask me, that's my opinion. However, it's a very safe procedure for people who are interested in only donated material. You may get this material in various places in Europe, but I specifically work with Dr. Kubinia in Vienna. Very good, and I recommend him. So I'm going to recap for people who did not join us until now. We are speaking about 3 sources of stem cells: bone marrow, placenta and umbilical cord MSC, and cord blood. And again, recapping for people who were not here, cord blood based on the blood of the baby that was in the umbilical cord during delivery. You have to match it with the donated type. So yours against the donated, it has to be the same. It is mainly used for patients with CP, cerebral palsy, brain injury, like drowning, like accidents, epilepsy with young children, autism, especially the younger children, so children under the age of 3, under the weight of 12 kilo, or just because of the parents' choice. It's definitely possible. MSC, umbilical cord derived cells, a certain type, so one type of stem cells that is made from the fat tissue that's in the umbilical cord and the placenta, mainly used for autism, epilepsy, older children, okay? Children over the age of 3, over 12 kilo, and even teenagers, even adults with these kind of issues. Also, other neurological issues, if we're talking about Parkinson's, etc., this is a treatment for you. And last but not least, bone marrow application, where I explain why I particularly don't like that method, but it is used for children over the age of 2, over 12 kilo. Not for children with cerebral palsy, just autism. It's important to say. Okay. So, how do we get these treatments? So we know now what they are. Now let's talk about how to get to them. So the number one thing to do is organize yourselves a medical file in English. It's important. In the medical file, you need documents about the child's diagnosis. You need MRI or EEG if you have them. Okay, not everybody has them. And if there's no signs of epilepsy, I will not ask from parents to get an EEG. But normally, I do recommend for children with neurological conditions to do MRI and EEG, or at least one or the other. Genetic testings, if they are necessary, if your condition may be genetic, and any other document that's needed. If you do cord blood, then you need your blood type. It's important. If you do MSC, you don't need your blood type. Attaching to these, you also need two videos, one with the child interacting with another person to see what's their level of social interaction. And the other is a child in physical or and eating processes to see whether he's able to reach their mouth, they use utensils, or if they can walk properly, jump, run, motorically play, and that's it. Don't make videos longer than 30 seconds. The doctor that needs to see your children see hundreds of children every month. So please, please, please make it short, make it to the point, make it inclusive. We also need to know if your child has allergies. What's your child's weight? Please, please, please weigh them properly. Okay, whatever you need to do, you do. Just please get us a good reading on their weight because every process here is done number of cells per kilogram weight. And the weight needs to be in kilograms, not pounds. I'm really sorry. I know people don't like the metric system, but this is the way it is. Okay, so put it in Google, find the metric system, and give the number in kilograms, okay? That's what you need in your medical file. I'm going to say it again in favor of whoever did not write it down. Diagnosis papers. If your child has autism, then an autism paper. If your child has CP, so a letter from your neurologist. We need to have information about their general health. So if they have any other condition, like epilepsy, like that, and bowel syndrome, like celiac disease, whatever. We need papers about that. We need to know if they have any allergies. We need to know their weight. And of course, if they're taking any medicine, also their medicines. Two videos, one of your child interacting with somebody else, and another of your child either eating or doing physical activity, climbing, sliding down the slide, whatever, running with their friends, whatever is fine. Not more than 30 seconds per video. I hope you got it down. Moving on to the next step. The next step will be choosing the clinic that you find fitting for you. There are over 150 clinics that does stem cells. Some of them are great. Some of them are absolutely horrible. When I look at a clinic and I review many, many clinics, in fact, I'm reviewing this month and next month 2 different clinics. What I'm asking myself is the following. One, who supervises them? Okay, in Mexico, it's a known problem. Nobody supervises the clinics. What we know is that Pernix is an organization that supervises clinics, does some of the work, but not nearly as well as the Ministry of Health in Europe, for example, or the Ministry of Health here in Israel. We also know that the union of cord blood banking in different areas is very good. So if your company works with the European cord blood bank, such as CBC Health, or the American cord blood bank organization, we know that this clinic is safer because they are being supervised by these banks. We also check for licenses. So in certain countries, you don't have regular inspections, but you do have an inspection when the institution is being open, and your doctors have to regularly get inspected. That's also one way of regulation. Find out what regulation the clinic of your choosing has. For the ones we work with normally, we check them for you, of course, and we have their papers. So that is something, if you go to a recommended clinic by us, you know that they've been vetted by us. Another thing that we check is what process the child goes through. So for cord blood, the process is very straightforward. IV, 30 minutes, we're out the door. So for children who cannot tolerate a very long process, cord blood can be a very simple and straightforward process, 30 minutes in and out, no problem. MSC is a little more, a little longer. It's 2 sessions. You can also do it under anesthesia. It's a little longer. Another thing that we need to look at is what kind of cells they get. Do they match the condition we're trying to treat? The child's weight, child's age, what's the process like? What we do for teenager, very different than what we will do for your cute, neighborly 1-year-old baby. So different children, different treatment protocols. We also check that. The last thing is, of course, is what we can financially afford ourselves. MSC is cheaper than cord blood. I explained why earlier. Bone marrow, not always cheaper. Okay, so I do sometimes refer families due to financial reasons to one clinic rather than another. Because it's a little cheaper, the family can afford it more. These treatments are completely private. Your insurance doesn't cover them. So this is something important to know. They're not cheap. Average to children is somewhere between 18,000 euro to 15,000 or 14,000 euro. That's average treatment with a good clinic. So the one we know they're regulated, they work properly, they're very experienced, etc. It could be anywhere between these two. It can even be higher depending on the protocol you go to, such as a clinic called Beike Clinic in the Orients. Very expensive. They charge up to 34,000 euro, but their protocol is 4 weeks long. It also contains all kinds of therapies like hydrotherapy and light therapy and a whole bunch of things. So sometimes I don't recommend a certain clinic because it's very expensive and not everybody can afford it. Most of us struggle to afford these treatments. So a clinic that's 35,000 or 34,000 euro is sometimes out of our budget. Some cases I do send it. And finally, after we've sent in a medical file and we've chosen a clinic and we got it accepted to this clinic, now we will meet with a medical director. A medical director will be a doctor, not a representative. It's very important. You'll speak to a medical doctor, which will explain to you the entire process. The reason for it is when you arrive to clinic, you will have to sign an informed consent form. Once you've signed it, that means you agree to the treatment and any side effect coming from that treatment. So it's extremely important. No medical conversation before treatment, no going to treatment. Haven't seen the doctor, do not get the treatment. Very important. You should receive it either via phone call, video call, Zoom, whatever, but you should have a medical consultation visit with a doctor before you fly. Okay, we've done the treatment. We've done very well. We managed to pull ourselves together, get the finance to do it, dragged our child to another place in the world, got their IV in, child got stem cells. We are now home. Are we done? No. 50% of the success of treatment is what happened in the rehabilitation process. This is when your child's body heals, so the brain heals, but now your child has to learn all the stuff that your child had missed. So speaking, walking, talking, moving, understanding social interaction, they're all depending on the parent, mainly the parent. How do I do it? I cook with my children. I play with Play-Doh. I speak to them. I read them books. I go with them to the swimming pool, and I try to push them every single day just a little more to understand the world. I do help parents to build these programs, but so can your speech therapist, occupational therapist, your parent guide, All these people are sources of information for us. Before we fly to treatment, we make sure that when we come home, we know how to work with our child. I know it sounds like a lot, but this is the key for success in this treatment. The brain can heal very well, but if we don't teach the child, we've not done the work. So failure in this treatment can be not enough work with children after care. Very important to know. So as always, two options. The one option is to keep on coming to lectures we give. We make sure lots of doctors come. We've already taped lots of calls and meetings with previous clinics. You are more than welcome to watch them. And another option, of course, is to come for a consult. I do private consultations to parents. I help choose clinics. We sometimes do also parents guidance, etc. We've been doing this for quite a while. You can see parents who's already done it in our Facebook groups and ask if you like. We've done hundreds and hundreds and hundreds of children in the last 5 years since our oldest was treated. And we are offering you now to come for a consultation. And since you've already been in our Zoom meeting, we're also offering a special discount over the prices you see now on the screen. And the prices for a person who's done a webinar with us is only $47. So if you choose to come for a private consultation, it takes about an hour and a half time, an hour and a half, depending on your child. This is where I check your medical background. I explain more about the different clinics, different options. And we come out from this meeting knowing what's the plan for this child. The price for somebody who's gone through a webinar, because you come with some previous information already, is only $47. I'm going to put the link to contact our director for this meeting, if you like, right now in the chat. Now, our meeting is finished, and I will make sure you can all voice your, hang on, loud. Okay, can somebody try to open your microphone and speak so you can ask questions, please? Let's see, can you speak on, no? Second.